Hello, today we are exploring canine heartworm disease, a common cardiovascular condition causing heart failure and blockages. We will explore many facets of the condition, like signs and symptoms, what heartworm disease actually is, diagnostics, and common terms you might come across. So, what is heartworm disease? According to Merck Veterinary Manual, heartworm disease involves worms spread by mosquitoes lodging in arterial vessels and primarily affects the pulmonary arteries, causing inflammation, endothelial remodeling, and vascular dysfunction. This arterial damage induces myocardial injury through necrosis, vacuolization, and strain on the right ventricle from pulmonary hypertension. The body compensates for heartworm disease mainly through cardiac remodeling and vascular adaptations to counter pulmonary hypertension from worm-induced arterial obstruction. Key mechanisms include right ventricular hypertrophy, or enlargement, and eventual dilation to maintain cardiac output. Heartworm diagnostics use antigen, microfilaria, echocardiography, and radiography for confirmation and spotting worms or signs like cardiomegaly. Antigen blood tests detect adult female worm proteins. This includes fast and accurate screening. Microfilaria check, microscope ID, larva in blood concentrate. Radiography reveals cardiomegaly, big arteries, and lung changes. Echocardiography visualizes worms and checks heart strain. So what exactly are we looking for after diagnostic testing? Heartworm tests show clear patterns confirming infection. As we discussed previously, antigen tests will be positive for adult female worm proteins. Microfilaria or larvae will be present in blood smears bilaterally or on both sides of the heart. Radiography shows cranial and caudal cardiomegaly or enlarged main pulmonary arteries. Echocardiography shows worms in right ventricle, proximal pulmonary trunks, or right heart strain. These results match active heartworm disease, so start treatment fast. Canine heartworm treatments include doxycycline for 30 days, which kills bacteria, monthly preventatives to clear microfilaria, certain injections, strict rest, which prevents clots, and anti-inflammatories. Monitoring closely can be life-saving. And here we have our terms list of all the terms that we have come across after going through this presentation. And here we have our references pages. And remember, an early diagnosis prevents chronic changes, which are important to discuss with your cardio vet. Thank you.